Hello and welcome to today's National Family Support Network Webinar Wednesday Network Spotlight with California Family Resource Association. We're so excited you've joined us today. And if you're joining us via your online, you can listen directly through your computer speakers. If you are joining via phone number, that Zoom provided, your line has been muted to minimize background noise. And for those of you online, please note that the link to the Dropbox folder is in the chat. Here, you will see that there are some handouts available for download. And in addition, you may put any questions today throughout the webinar in the question section at any time, and we will get to your questions during that portion of the webinar. We ask that you direct all your questions to the Q&A portion, but feel free to use the chat and engage with us during today's presentation with our presenters. If you are having any technical issues, we do have tech support on the call with us today, so feel free to reach out to Cheryl and she can help you with any technical needs. And at the end, I will try to get to all of the questions that you share today. And if I do not get a chance to answer all of the questions, someone from our team will follow up with you following the webinar. Today's PowerPoint, as well as the recording and all of the handouts, will be available on the National Family Support Network website 24 hours after this webinar takes place. So take a look at the Webinar Wednesday page tomorrow at this time. And when you exit the webinar, we will have an evaluation. It will automatically appear on your screen. And we ask that you take a minute, fill this out. We value your feedback and use it to inform future webinars. So today, my name is Jennifer Green. I'm the Senior Manager of Membership and Events, and I will be your moderator for today's presentation. First, before we get started, I wanted to launch a few polls with the group to find out where are you joining us from. So take a look at the map and find your state or country. And there's a poll on the screen if you can take a minute. So where are you joining us from? Are you from the Northeast, South, Midwest, West, Canada, or other international? And if you are from another international location, if you can put that in the chat, it would be helpful. Just a couple more minutes, not minutes, seconds to click your button and we will close that poll. All right, thank you for selecting where you're joining us from. So let's see the results. Wonderful. So I see a large group from the West with us today, and we have a few from the Midwest, the South, and the Northeast. Wonderful. We are glad you are here with us. One more question here. And what is your affiliation? Can select Family Resource Center Network, another family support program, education. Are you in government child welfare? If you select government other, if you can put that answer into the chat. Or are you a private funder or other? What other category are we not including? Just about 10 more seconds. Thank you so much. All right, we can close that poll and let's see, what is your affiliation? All right, I see a couple from Family Resource Centers and Family Resource Center networks. All right, great. We have a diverse group. We have some funders, we have some government child welfare, as well as education. And if you, as I mentioned before, I see a handful of you have selected other. If you can pop your response into the chat feature, let's make sure our chat is working before we get started today. Put your result there. All right, and the last question is, what level do you work at? One more poll here. So which level do you work at? Are you focused on policy level, systems level, management level, or program level? If we do not have your level included there, you can also respond in the chat. All right. Thank you, Carol, for responding there. All right. Wonderful. Glad we have a standards trainer joining us today. All right, let's close this poll and let's see which level everybody's working at. Great. So this will be helpful for our presenters today. So we have some systems level as well as management level. Um, Almost half of you from program level and others. So I see consultant on the side if there's any other responses. It'd be helpful to see what other areas are you at. All right, well, let's jump right in. We can close those there. Thanks so much. All right. So over the last decade, the National Family Support Network has quadrupled in size to now have 37 member networks. That's 36 states and the District of Columbia that represent more than 3,000 family resource centers that serve more than 2 million people annually. And our newest members are Louisiana, who joined us back in June. And the National Family Support Network mission is to promote positive outcomes for all children, families, and communities by leveraging the collective impact of state family resource center networks and championing quality family support and strengthening practices and policies. And so the vision is really about that map that you just saw, turning the whole map green so that all families will have access to quality family support services in their communities provided by family resource centers supported by strong networks. So for today, here is our agenda. We will begin with an introduction, which we have done. We're going to dive into Family Resource Center networks. We'll get to hear from California Family Resource Association and hear their story. And then we will share out some National Family Support Network resources and opportunities for you and close out with our evaluation. So let's jump right in. So thousands of family resource centers have emerged organically across the country, yet their existence still largely under the radar as America's best kept secret. And generally, people have heard about them and think they're the best thing since sliced bread, or they just haven't heard of them. A family resource center is a community or school-based welcoming hub of support, services, and opportunities designed to support families to be strong and successful. And the top image here on the left is from a community-based family resource center in Vermont, and the bottom one is from a school-based family resource center in Kentucky. And so family resource centers, looking now one level up, we talk about family resource centers and how they are connected. So not only have cities, counties, states hit upon the value of family resource centers, but they also hit upon the value of networking them together and ensuring that coordinated support and being able to serve as that backbone entity. And they can be created in a variety of different types. And some of the most common functions of family resource centers here, this research and data comes from the national study that the National Family Support Network worked with a research institute in Colorado on. And the most common functions here being that they increase connectedness, cooperation, coordination, and collaboration amongst members. So we call that the 4 C's. They also have the opportunity to provide training and technical assistance for family resource centers in their network. Some networks also work on advocacy, policy, and legislation, being able to give that systems level support. And some networks also provide and maintain a shared data tracking system, so help with data and evaluation. And the way we talk about family resource centers is first off, stages of network development. So this is broken down into the emerging phase, which is that 0 to 3 mark. Your network is just getting started. This is the beginning stages. You're determining who will be at the table and what do you want to focus on. Then as you move further along the continuum, you move to that evolving stage where it's the 3 to 5 year mark. It is you may have a staff member come on board or a consultant. Your network really begins to evolve and have more structure and capacity to do more. So you're further developing. And then the furthest on the continuum here is when you hit that 5 year mark. So five or more years, you're an established network. This is when you typically have a track record of activities. And one interesting characteristic of established networks is that they have weathered crisis and decided to stick together. And another way that we categorize Family Resource Center networks is by the type of network. So one type of network is a volunteer coordinated. So this is led by FRC directors themselves in voluntary leadership positions without paid network staff. And so they're doing this work on top of the many hats that they already wear. This is one additional role that they play, and a couple of examples here being West Virginia, as well as our new network, Louisiana. And another type of network are the funder coordinated networks. So these are either led by a public department or foundation that both funds and convenes the network, convenes the centers there. And so a couple of examples being New York and Nevada. And the last type of network is an independent nonprofit. So this is staffed by an independent nonprofit organization that functions as a membership alliance with members paying dues. And these networks may raise and distribute funds, such as being an intermediary or not. And a couple of examples is Colorado and Maryland, as well as our California network, who will share with us today. So with me, I have 3 wonderful presenters from California. So we have Michael Williams, the Policy Director for the California Family Resource Association and Child Abuse Prevention Center, and his colleague, Victoria Hartman, who's the Program Manager with California Family Resource Association, also known as CFRA. And we also have Amanda Guajardo with us today, who's a member of the California Family Resource Association. She's the Executive Director at Tulare County Child Abuse Prevention Council. So I will pass the baton to Michael.
Thanks so much, Jennifer. We can, and this is us, the California Family Resource Association, and we can click to the next slide. And I have a question. You can put your answer in chat. When you think of California, what comes to mind? And you can do another click. If you've toured here, what may come to mind have been some of the great attractions here. Also, California as kind of likes to boast of all our superlatives. We have the tallest trees, the biggest trees, the oldest trees, the highest point in the continental US, the lowest point in North America, the most populous state at 39 million, all that stuff, more food crops, is the biggest producer of most food crops, And the reality is, and on the next slide, California is pretty complex. And someone shared this with me because I love to talk about all the different areas in our state, and in a tongue-in-cheek way catches who we are, all the way from the big volcano down to the giant stinky lake and all the mountains and hippies and otters and garlic in between. And I got to apologize, our featured member, Amanda, is from Tulare County, which is far more than something to drive through, which she'll tell us. Some things to notice is that if you look at the vertical, Los Angeles down there at Sig Alert actually is east of Reno. We stretch that far. And that big green area, San Bernardino County, is bigger than 9 other states in the country. It's the biggest county in the country. Los Angeles has 4 million people, which is bigger than 22 states in the country. So very, very complex. And really what that means is, and we'll go to the next slide, is what Jennifer just commented. There's great diversity in California. And I just love to share, there's our farm workers, there is a Sikh festival up in the northern Sacramento Valley, a Mexican American festival in San Jose, our Armenian historic photo, a Juneteenth celebration in Oakland, and Redwood Canoes up in Del Norte County. We're very proud of our diversity, and this diversity means, I think it takes one more click, a diversity of family resource centers. And some are school-based, some are community-based, some are big. I mean, the whole gamut that Jennifer described. We also have many state networks, and that is very complex and diverse, and not state networks, county level or regional level, or sometimes city level networks. So some are very structured, some are their own nonprofits. You'll hear from Amanda, who in Tulare, it's very interesting to us. She's with the Child Abuse Prevention Council, which has become the de facto network of family resource centers. It's where they get together and have impact with their other partners in the community. So next slide. Some of the things that our family resource centers are on the forefront of, well, one, again, is the diversity, which, as we all know, is kind of the future of the whole country. That largest blue, almost half of the circle is Latinx. Euro-American white is the next biggest, and all the rest is the diversity. And next slide. And with that comes a lot of, not with that, I think, with representing the diversity of needs in the country, but also the economic disparities and the boom and bust, come a lot of the problems that folks face, that folks know about. This is California housing costs, and noting that renters, and well, half of California's renters and over a third of homeowners have high housing costs that are either cost burdened, 53% of renters, 37% of homeowners with mortgages, and 16% of homeowners without mortgages. And then even severely burdened, there's over 28% of renters and 16% of homeowners, so who have to spend more than a third of their income on housing costs. Next slide. And then child poverty. You wouldn't know it with all of the talk of the wealth in California and Silicon Valley, but we have the highest child poverty rate in the country. 25% of children, in even more extreme for non-English proficient parents. And that percentage is even higher for undocumented immigrants, and which we've got from other sources, and we can share it another time. But also Latinx and African-American families disproportionately impacted by poverty as well. And next slide, and I'll pass it on to Victoria.
Thank you, Michael. So just an overview of the California Family Resource Association. CFRA was founded in 2005 and is a statewide membership association of organizations that serve children and families, so primarily family resource centers. And our purpose is to advocate for programs, policies, and resources that help families and communities thrive and succeed. We also build the capacity of our member organizations, which are networks and family resource centers, to impact policy change, partner with local government and community allies, and achieve sustainability with our funding. So we are an organization under the Child Abuse Prevention Center in Sacramento County. So that's where our office is located, even though we are a statewide organization. And the CAP Center, it has a 35-year history of preventing child abuse and neglect. So our key strategies are educating lawmakers and positively influencing policy, which Michael will talk more about what our current advocacy efforts are. We also work to increase public and private funding for programs that support the economic, social, and educational well-being of children and families. We also support networking and building membership to create a unified policy voice and share best practice program approaches across our networks and family resource centers. And we also support with strategic communications that inform public policy officials and private funders. And you can go to the next slide. So we currently have, so like I said, we're primarily composed of family resource centers and networks, and we currently have about 103 family resource centers as our members and 29 networks with over 30 FRCs as part of those 29 networks. And we also have 14 individuals, which are typically folks who have worked with family resource centers previously, consultants, and other folks that want to support the effort for family resource centers. So we have currently a total of 146 members. You can go to the next slide. So here are some photos from our family resource centers that are also members, as well as some of our grantees for some of the grants that I'll be reviewing. So our programs are advocacy and policy, like I just shared. We currently also have a couple of grants that we are implementing with family resource centers and networks across California. So one is the Child Tax Credit Outreach Funding. The next one is Vaccine Equity Campaign Funding. And then we also are the intermediary for the FRC COVID-19 relief funds in California. We also support with training and capacity building for our members. We strengthen networks through collaboration and committee work. And then we also promote the standards of quality family strengthening and support, as well as supporting with coordinating training for that across the state. Next slide. So we have a couple of committees within our CFRA statewide network. Our committees are the CFRA Leadership Committee, which is made up of the chairs of the rest of the committees that we have. We also have our CFRA Policy Committee, and the chairs for that are Dr. Ron Brown and Katie Albright. And Dr. Ron Brown is from Children's Bureau down in Southern California, and Katie Albright is from Safe and Sound from the Bay Area. So we have kind of representatives from all across California. And so that's our policy committee. We also have a networks committee, and currently our chair is Debbie Comstock, who's just absolutely wonderful. I'm sure that many of you know who she is. And then we also have a newer committee, which is our Equity and Community Voice Committee. And Amanda, who will also be presenting today, is one of the chairs, in addition to Jennifer Rangel. And so that committee specifically is around supporting FRCs and networks with elevating community voice. And currently some of our projects for that are having a series of webinars around elevating community voice and sharing best practices and frameworks for community voice at FRCs. Let's see. And I think this is yours, Michael.
Yeah, so CFRA's history, well, I think as National Family Support Network does, we like to acknowledge our history all the way back to the settlement houses. One of the pictures I shared was the Good Samaritan Center in the Mission District in San Francisco. That was originally a settlement house, although it's a more modern building now. And in the 70s and 80s is when family resource centers began to emerge as a model. Got a real boost in the 90s with the California Healthy Start Fund. And then started to coalesce as a shared practice model. And a monograph was created in 1998. It's available on the CFRA website. I don't know if it's in the Dropbox, but we could put it there. Family Resource Centers Vehicles for Change, and describe the work of family resource centers. And we hope it's helpful to others in the state and around the country. Also, the first 5 California was established. And many counties the first 5 are funded by the tobacco tax. They're county by county commissions that make their own investments around early childhood, and many invested in family resource centers. There is also a program that is also now operated by the CAP Center Strategies. It was set up by the Office of Child Abuse Prevention to support family resource centers and other organizations. In 2005, CFRA was launched. There was also the Strengthening Families Protective Factors training was piloted in 7 states, and California was with Strategies as the California lead. Shortly after that, the California Network of Family Strengthening Networks launched to be a network of networks for FRCs, and Andrew Russo was very involved in the beginning, and it was a lot around launching the standards for family strengthening support around the state. And the next slide. And then 2011, National Family Support Network was founded. In 2015, actually, I think it was later, 2018, Family Resource Centers Vehicles for Change Volume 2 was launched. I see something I'm missing from here is in 2016, CFRA was adopted by the Child Abuse Prevention Center. So it made a shift from voluntary network to an independent nonprofit. And now we're an independent nonprofit that has both intermediary programs that Victoria will describe more, as well as non-intermediary supports for FRCs. In 2020, that network of networks with Debbie Comstock is one of the leads, merged with CFRA, and CFRA merged with them, and we came up with that mission statement you saw came out of that merger. And that also became a time, and I'm sorry, I'm skipping around. In our advocacy history, very significantly in 2019, Senate Bill 436 was passed, and that was a lobby on CFRA, from CFRA to get family resource centers defined in statute. We had some legislators and administrative folks who were very impressed when they would tour family resource centers saying, well, we'd love to give you money, but if you're not in statute, then we can't. So it went into statute. Shortly after that, as we all know, COVID hit the nation and the state, and the governor created emergency funds for COVID, 3 million of which were dedicated to family resource centers. And CFRA became the intermediary for those. It was a quick turnaround. In 3 months, we got emergency funds out. Again, in 2021, those were renewed, and since then, we have been campaigning for a permanent place for family resource centers in the state budget. And next slide. So our recent accomplishments are that merger with the California Family Support Network, our membership growth, and I think even these numbers are small, more than doubled in a year by a lot of direct outreach. And I think it speaks to working in a big and complex and county administered state that there are probably far more than 120. We think there may be as many as 500 family resource centers in the state. So our efforts at outreach have had to been pretty constant and still go on. The COVID relief funds were definitely an accomplishment, and we have a new state policy platform that you can see on the CFRA website. Child abuse prevention, funding for family resource centers, and equity and diversity and inclusion are high among those priorities. We came very close this year to state funding for FRCs. 25 million was in the joint legislative budget. It got dropped in negotiations at the last second, so we are back at it to more solidly get them in the family resource centers in the state budget. And next slide. So this is our legislation that defined family resource centers, an entity providing, well, I'm not going to read it all. You can see it. We can share it when we share the PowerPoint. but this is how we have distributed the COVID relief funds in what we've written into our current funding proposal, the state definition for family resource centers. And next slide. So the current investments in FRCs, 15 million through the COVID relief combined between the two rounds of it, $1 million in the vaccine equity funds, which are about, Victoria will describe it, about making vaccines more accessible, and 150,000 for child tax credit. And next slide. And this is where I hand it back to Victoria.
Okay, so I'm going to review a couple of the grants that we have as that we are intermediaries for, and some of the outcomes. So as I mentioned, we are the intermediary for the COVID-19 FRC relief funds across California. So in this map, you can see all of the blue are counties that received funding through the FRC relief funds. And then there was only 2 counties that did not apply for the COVID-19 funding. So the majority of our counties across California had FRCs that received the FRC relief funds. So since 2020, we have distributed over $16 million in COVID-19 relief funds, and those funds go towards, they're pretty flexible, which is what family resource centers need, and they would go towards material goods, isolation needs, parenting resources, linkages to local benefits, mental health, utilities assistance, support for returning to work or school, and then support for education and distance learning. So that's a lot of categories, and there's a lot of things that fit into those, which is really helpful for family resource centers who are so diverse in each county statewide. And so 99 FRCs or networks received funding. And as we mentioned before, networks have multiple FRCs under them. And so really it's more than 99 FRCs that receive the funding, but we have 99 grantees. And some of them are our CFRA members. So some of them do have CFRA membership, but some of them don't. And so we've been kind of working with those who have not yet become members to become members and receive the benefits of being a CFRA member. So far, we have received we have served 235,499 families. Well, our family resource centers and networks did from April 2021 to June 2022. And this grant will continue through March 2023. And so just taking a look at what the needs were with this grant, material goods was the greatest need. It was what was used the most was material goods, followed by parenting resources. So that could be parenting classes, curriculum, and any other resources like that. And then also linkages with local, state, and federal benefits. So I'm sure that many of you also have experienced the same kind of needs at your family resource centers. So we were really grateful that we were able to provide this funding in a way that's flexible and best fits the needs of FRCs. Next slide. So another one of our grants is our vaccine equity campaign that we have through our Sierra Health Foundation. So that's the funder for this vaccine equity campaign. And the activities under vaccine equity are to do outreach for vaccinations and then also host vaccination clinics. So this grant was only over 3 months this year, and it's just amazing how much our FRCs did. We had 18 grantees, so again, either FRCs or networks, and we wanted to ensure that the funds went to counties that had low vaccination rates. So that was some of the criteria for the application for this grant. And priority funding was provided to those folks who have low vaccination rates in their counties. And then just some of the outcomes were that our grantees conducted 267 outreach activities and hosted 55 vaccine clinics all in the span of 3 months. And 116 individuals were vaccinated against COVID-19 during those 3 months with these funds. And the funds weren't huge, so they really did a lot of work with a small amount of grants to be able to support families in their communities with COVID-19 access. And so of the 1,016 individuals, 645 reported their race and ethnicity. So at the chart here, you can kind of see who the majority of the, what the race and ethnicity was of the individuals who are vaccinated. And as you can see, the primarily, which is aligned with our overall demographics of California, our Latinx community received a lot of the vaccinations, and they also experience a disproportionate rate of contracting COVID-19. So, we were able to kind of address that disparity with this grant, but also it really demonstrates the cultural responsiveness of family resource centers. And I know that a lot of them did the translation, interpretation, and made sure that the materials that were used for outreach were accessible to folks who spoke many different languages. In looking at the different activities that they conducted, most of it was phone banking, but we also had text banking, we had community canvassing, booth or tabling, and one-on-one direct messaging. So our FRCs are really effective in getting the word out there because they already provide a lot of services to the community. So just kind of sneaking in flyers here and there and conversations about the vaccines have really made a difference in getting folks vaccinated. Next slide. So the other grant that we had recently was a child tax credit outreach campaign. And it's not too late for families to enroll in the child tax credit, but there are a lot of families who experience barriers to accessing this. There's a lot of folks who don't file taxes. And so we've really been working to promote getting folks filed and getting them access to this really great benefit for families. And so through that, we also partnered with FRCs and networks, again, provided small mini grants to 16 of them, for just the 3 months. And the activities were to conduct level 1 activities, which is one way, where, they're sending mass text messages or emails, hanging posters. So just some activities that are outreach for, the general public. And then level 2 activities, which was doing more one-on-one conversations, Q&As at tax filing events, working with local tax sites. So kind of doing some more two-way conversations as far as outreach goes. So in the 3 months, the 16 grantees conducted 424 outreach activities. They hosted 22 tax service events. They either did the VITA themselves at their FRCs, or they partnered with tax prep services. And then they interacted with 156,660 individuals. So they provided that information about child tax credit to that many folks. And of course, another thing we did to support our grantees was connect them with webinars and trainings on how to navigate child tax credit, because doing your taxes can be a little bit stressful, and folks can, the staff at the family resource centers may not be tax experts, but in getting access to these webinars and trainings, they were able to learn enough about the child tax credit to support families with getting access, and again, in a culturally responsive manner, and providing the materials in translated languages that best fit the needs of the community. And we can go to the next slide. I think this next one is Michael. Or no, this one is Amanda.
Hi, thank you, everybody. I think the biggest challenge this afternoon is going to keep is the time limit that we have, because we have some really exciting things that we have been able to do and are looking forward to doing in partnership with CFRES. So thank you for the time to share what we feel is really important information. Our organization is one of the networks. The Child Abuse Prevention Council is, and if you are not aware of how this is structured in California, but we are in the Welfare Institution Code. And so every county is required to have a child abuse prevention council. And so we're all set up a little differently depending on how we're funded, how we're structured. But as you can see, our county is right in the middle of the Central Valley. So we do not have beaches, we do not have, but we are a day trip from anywhere. So the Northern Cal, Hollywood, the beach, the mountains, we are a day trip. So we are very, very unique and very proud to be able to serve a very, very diverse community. Next slide. I think these were just some of the statistics, which I think Michael kind of highlighted a little bit, but I wanted just to give you a little bit of background on the population that we serve. We do have the largest racial ethnic group is Hispanic, 65%. Again, all of what you're seeing here are day trips away, and 23.8% of the population whom poverty status is determined for live below the poverty line. So we are one of the poorest counties in the Central Valley. However, it's really interesting that we feed a big portion of the world. So agriculture is our biggest economy, but we tend to be the poorest and hungriest in the state. So we have a lot of challenges in our county. Next slide. So as I mentioned before, and you can go to the next slide because I talked a little bit about who we are. So every county in the state of California has a Child Abuse Prevention Council, or a CAPC. We all have a common mission. Obviously, our name says what we do. We all take a different way of maybe sharing why we do the work. We are really, really proud in Tulare County to work really collaboratively with our community, with tribal and parent partners. The purpose of our collaboration is to communicate to all the residents in Tulare County the vision and the plan for preventing child abuse and neglect in Tulare County. And we do this, again, we want to be there before something bad happens. So we do that by promoting healthy families and communities. Next slide. Here is a view of what our particular Child Abuse Prevention Council looks like. And you'll see that we are really, really proud to have a diversity of partners who have a voice at the table for prevention efforts countywide. We have 3 primary roles, which are pretty interlocking and overlapping. Our role as a catalyst for prevention is to inspire and promote civic and community engagement in protecting children and preventing maltreatment. As conveners, our organization brings traditional and, as you can see, really non-traditional partners together to impact the county's child abuse prevention agenda. You can see here we've got a lot of family resource centers, we've got healthcare organizations, we've got other nonprofits, school districts that again have a voice at the table. Lastly, our role as coordinator of countywide prevention efforts is to make sure that we're aligned with the larger prevention efforts statewide through public awareness and education. So we do a lot of training, a lot of primary prevention outreach. And each of these roles have to be supported with as you know, foundational capacity, knowledge and skills and resources in order for us to accomplish what each of these roles require. And we are really, really fortunate to be able to benefit from the partnership with CFRA to be able to do this. Next slide. We know that the world is very different than it was 2 years. So much has happened in the past 2.5 years, and we were able to benefit from the COVID relief funds, and the service type that we focused on was parenting resources. I was doing a parenting class a couple of weeks ago, and we were talking about how much of parenting was done in isolation during COVID. We didn't have the circles of support that we typically have. And so it is a very different world. And there was so much isolation amongst children and families and our communities. The calls for suspected child abuse went down significantly in our county. However, the calls for domestic violence went up, and the sale of alcohol went up. really significantly in our child. So what we were able to do with this partnership with the COVID relief funds is to share with all those updates and provide, CFRA was able to support and increase this shared ownership and responsibility for prevention activities with our family resource centers on a real practical level. It really meant engaging in dialogue to assess, everybody's viewpoints. Everybody has a different lens to prevention. We were able to build a real consensus using research, data, and stories, which are really, really powerful. We provided every month's data on what was happening in every single zip code in terms of demographics, what we were, so all of our FRCs had statistics on what type of suspected abuse was being reported, where the reports were coming from, what ages and what trends were happening in every single one of the communities that they serve. This really helped us to ensure that everyone who wanted to play a role in is considered important and that they were allowed to do so in our prevention planning. Next slide. One of the things that we were really, really proud to do and always love to have the opportunity to share this part of what we are now doing as a result of this partnership. We have developed our first parent advisory committee. Here, I think we're the only child abuse prevention council in the Central Valley that has a parent advisory committee. And this came from representative parents who represent several family resource centers in the county. We were able to take them this summer through a parent leadership training institute and provide them with skills and strategies to create change in their own families and organizations. We were able to make that connection. And these are all families who committed to, I think maybe we did 8 weeks of parent leadership training, and they are now all equipped to go back into their own communities and start not only becoming leaders in their own families, but in their own communities. And we were able to do this because of the funds of CFRA. They supported the cost of the use of the facilities that we had. We were able to feed everybody during our trainings, including provide free childcare. And we had some that were bilingual. And we also were able to provide parent initiatives to incentives to participate. So we were able to give travel vouchers for participating in the training as well. So we had representation countywide from several different family resource centers. And we're really, really excited that this is, again, that really important voice of lived experience that is at the table now and has a really significant voice in our planning. Next slide. We talked about the fact that during COVID, a lot of what was happening in our community was in isolation. We are one of 2 counties in the entire state of California that has this multi-sensory exhibit called the LISA Project. And the LISA Project is an exhibit that showcases the stories of children who are victims of family violence. So it is, the visitor is immersed in the world of abuse, hearing stories through an audio device. You take a tour through what's a simulation of rooms of a home, and each room depicts a specific form of abuse or neglect, including exposure to domestic violence, neglect, physical, emotional, and sexual abuse. And so we were able to partner with family resource centers and other community-based organizations during this time that we knew stuff was happening and we needed to give people the permission to talk about it. so in partnership, and this is a dynamic, we use this exhibit to raise awareness, to connect victims with services, and to remind mandated reporters of their responsibility. And again, we were looking at children through a very different lens. And so we really tried to emphasize through this tool that we all know what cuts and bruises look like. However, we're now looking at behavioral indicators of abuse and neglect and the result of children who were home for 18 months with their perpetrator or witnessing domestic violence. So a lot of things that we need to anticipate moving forward. Next slide. This is a picture of a couple of events that we've had over the past year or 2 years. Again, it's a portable exhibit. It requires a lot of volunteers. We get a lot of great response from our youth. A big target population is our high schools, because we know that that's where the cycle can be broken. And so it's always a great opportunity for us to go into these different communities, but it's really important for us to partner with our family resource centers, because once we leave with our exhibit, we leave. But these family resource centers are the ones that stay and follow up with questions or resources that need to happen with having this exhibit in the community. Next slide. This is one of our local parent resource, family resource centers here in our northern county. And Parenting Network, it has 3 different sites in the county, and this is our northern site. They hosted the LISA project and again have a voice at the table with all of our awareness, educational, and information events. So we're really proud of the fact that when we go into a community that we have really strong relationships with that FRC, so that they can continue to do the work that we have started in that community. Next slide. One of the things, we have another slide of our parent advisory committee. Again, this is something that we would never have been able to do with the partnership with CFRA, and the fact that it brought us together in a more intentional way with our family resource centers. We now have, I think we have 90% of our family resource centers that are members of our Child Abuse Prevention Council. And so again, together we can do more, and just really grateful for the opportunity to be able to share some of these resources in a more diverse way. Next slide. I think that's my last slide. Yes. Thank you.
Yeah, I think it's my turn now. So through a lot of this, these experiences, especially working in such a big and diverse state, in recent years, we can point to some lessons learned. One, I don't know if I've expressed it here in the slide. Now that I'm thinking about it, I think just hearing Amanda is just the amazing power of what family resource centers can do, given the latitude and the resources and the ability to really empower parents in their communities. I started to answer some questions in the Q&A, one around how do FRCs get startup? There's no single way. Some had opportunities with Healthy Start, some with First Five. The state did a small startup funds for FRCs, but that's why we're advocating for funding. FRCs need a stable core of funding, that folks, that private and public funders will turn to them for disaster relief, time-limited, very narrowly defined program grants, all these things, but nothing to keep the core stable or to allow communities to start up new FRCs. In a county-administered prevention and social service system, state funding needs to be flexible while still clear on what it delivers. For us, member leadership makes all the difference and needs support. So again, we have diverse members, diverse networks in our larger network. And so we're, as the nonprofit staff, really are in a position of the momentum of growing our membership and its impact in the state has all to do with how we can support the members and link them. Someone asked if we have webinars, and yes, we do. We had some on Community Voice, some on responding to the Afghan community, some on the Family First Prevention Service Act. Recordings are on the CFRA website and YouTube page, but we're budgeting how we do those because member time is stretched, so prioritizing is important. And especially in our advocacy, we learned that community voice is difficult to mobilize for a statewide network. We know we have colleagues who have done it really well, and we would like to emulate that, and we're working on it this year. And it's central to our mission, and the potential for change is huge. So that's some of our lessons learned. Next slide. So what's ahead? Our campaign for state budget. First goal to get into the governor's budget. We're having regional forums led by our members. We'll be working on mobilizing family and community voice. We're working on the program design so it's more competitive for state funding, and we'll have more advocacy activities. We are building member leadership through the regional forums and a virtual gathering, and we will keep building these funded projects. But I want to leave at least a minute or two at the end for questions and answers, so I think I will leave it there. And these are our current funders: California Office of Child Abuse Prevention, David Lucille Packard, Sierra Health, and SH Cal Foundation. Okay, now we can go.
All right. Well, I think we definitely have more time. I see lots of questions have come in. And first off, just want to give a virtual applause to Michael and Victoria and Amanda for sharing their work. I want to pause here and see if there are questions. Thanks, Michael, for answering some of them.
Sure.
All right. So I see there is a question here about funding. Looking specifically in Los Angeles County. I know Victoria chatted out that you guys were working on a membership directory, but just wanted to put this question out there to answer from David about how many FRCs are there in Los Angeles County and if there's a budget for an FRC in LA County specifically.
Our experience, so with having our policy leadership coming from LA County, we've not done a systematic study of funding or staffing at FRCs. We don't even know that we have all of them in our orbit. So we do know that LA County doesn't have a dedicated funding stream, that FRCs there need to be resourceful in patching together funds. But we can connect you with some of our members there who might have some insights.
Thanks, Michael. I think you answered the second question there a little bit too about county investments, if counties invest specifically in FRCs.
Yeah, county child welfare will sometimes contract with FRCs for things like home visitation or not supervised visitation or home visitation, but and they may through the Family First Prevention Service Act, but again, not consistent.
Thanks, Michael. All right, and I see another question here is kind of a more wider approach, but I'll let you give a California lens. So how many staff members does a typical family resource center have? And if anybody wants to take that question.
Well,
I can share a little bit about Tulare
Tulare.
County. So we've got family resource centers that are as small as maybe 10 staff, but we also have like Parenting Network. They have 3 different sites, and they have dozens of parent partners and leaders and social workers. Our organization that serves the entire county, we have 3. So we lead the prevention efforts for child abuse and prevention with 3 full-time staff, which is why you see that it is really important for us to be able to have partners like our FRCs and other community-based organizations and CFRA, because we cannot do this work alone. So yeah, it's all, it just depends on how they're funded, how they're structured, the population that I think it's great that they all look very different because it means they're serving the needs of their particular community and really try to reflect the population that they're serving with staffing as well. So that's kind of a hard question to answer because it's not one size fits all.
Thanks, Amanda. That's definitely the response across the nation is they look very different. They're very unique to the needs of the community as a diverse state in California, similarly across the US. Great. So I'm going to go a little bit into someone from Georgia has asked, how does one start an FRC in a state that has not completed their prevention model, who's been working on it since 2018? And I see, Michael, you did add a response there. I'll let you elaborate and then I can also jump in after you guys.
Yeah, and just that there's not an easy answer. That's the struggle. Sometimes public funds are made available and resourceful FRC leaders know how to take advantage of that, but it really is catch as catch can in a lot of ways.
Yeah, it's different across. And Viola, I would encourage you to check out the National Family Support Network membership page where you can find, we actually have a network that convenes together in Georgia. So you can reach out to the points of contact there if you go to the membership page. Also for anybody else on this call, if you're interested in getting connected to your member network, or if you're not a member, you can go to the membership page. There's a map. And if you click on your state, the specific network spotlight will pop up with contact information and details about the network, and is a great way for you to get connected. Outside of that, as well as looking at family resource centers and resources that are available on the National Family Support Network page, we have a whole page dedicated to family resource centers. We have a whole page dedicated to family resource center networks. We have a variety of continua, looking at your journey of where you're starting, where you're going, what are the next steps, what are resources that are available. And we will be launching soon, later on this calendar year, a resource which Strategies in California is helping us with, was on the planning committee for an FRC learning hub. So the National Family Support Network will be launching the Family Resource Center Learning Hub, and we're excited to share more about that. And we'll feature this on an upcoming webinar Wednesday as well. So you can learn more about what's out there, what resources are available, best practices and strategies, and because of those same questions. How do we get started? How do we start up an FRC? And there are so many people who have paved the way. It is still hard work, but there are resources to help you. Let's see if I have any additional questions. All right, so do FRCs take part in any consistent program or agency evaluation efforts and report to the funders to streamline reporting? And if so, what does that look like? And how was it impacted by COVID?
That's big. Again, it's county by county. I think those that receive first 5 funding often have a consistent evaluation process. We're in designing the new state funds. We're looking, actually, I don't know if anyone's here from Colorado. Our Colorado colleagues have been really helpful. And we're looking at that as a model for more consistent evaluation around the state.
Thanks, Michael. Yes, I would concur with Michael's statement about Colorado has some resources available for you as well with data collection and evaluation. So their fees are also nominal too for this sort of statewide. So check out the membership page and look at the Colorado network. They're the point of contact for those resources. All right. Let's see. I don't see any more questions in the Q&A portion that have come in. I think we've gotten to everybody's questions here. Let me see the chat, make sure we're covered there. glad you guys can connect. I can go back to the contact slide there for you guys. That is Michael's contact information. How can we connect with schools? Oh, one more question. How can we connect with schools who are developing wellness centers and community schools? I know California has a large footprint of community schools, so I will pass that question to you guys.
But they're very slow to roll out, and so we're still learning. And so we're trying to learn from our members.
Awesome.
I'm sorry, Victoria, like I've been hopping in on these. I don't know if you would add anything to give my answers.
No, I don't think so. I think you've covered a lot. I will say about the evaluation and COVID, we do in the Dropbox have our COVID-19 report that kind of highlights some of the data and outcomes that came from the implementation of the statewide funds. But yes, I'd agree with everything that Michael is sharing.
And so would my dogs.
I'll share a little bit about how we as a county organization are reaching out and connecting with schools more. One, we invite them to the table. We know that most of our mandated reporters are teachers or school counselors or social workers. So what we did as the mandated reporter trainers is that we modified our training so that we were not just focusing on physical indicators of abuse, but more behavioral, because now we've got kids coming back to school with behaviors that are the result of COVID. And so we made sure that we offered that as professional development. We also found that it has been really impactful and relevant to teachers to get training on adverse childhood experiences, on ACEs. And so we now provide training upon request to pre-K through 12 for anybody in the education field that wants information on ACEs and its impact on development. So, and that has been, we've gotten a really, really good response from schools, whether it's their nursing department or their mental health workers or their administrators. So that has been a really great way for us to connect with schools.
Thanks, Amanda. All right. And I think it was great to hear from Michael at the end of the presentation about the momentum that took place with state funding this year and how CFRA was able to lead those efforts. And so I just wanted to pause for a minute here to talk about where that momentum went and now where it's going to wrap up this Q&A portion.
Yeah, thanks, Jennifer. It was you're making me think. There is a very virtuous cycle. A lot of great things kind of built at the same time. And after we got the funding in the state, the definition of FRCs in the state budget, what was happening in parallel, and I think had impact, was our merger with the California Network of Family Strengthening Networks, because that brought in a lot of new member energy. And that was just in time for the COVID relief funds. The second time around with the COVID relief funds, folks were able to write CFRA dues in as part of their COVID relief. And all of a sudden we had more and more members. And that's when we were ready to visit legislators. And those members were really ready to help us connect with their legislators or join us when we've had appointments with legislators. Just the growth of the active engagement of our members, folks like Amanda and our Equity and Community Voice Committee, just really built and built and built. We had proposed $40 million a year ongoing. We got in the joint legislative budget $25 million for 1 year. We'd have dealt with it, but then that got dropped. And so we're looking at, as I said, giving the program more definition, as with the Colorado model. I'm obviously about these dogs, and shooting for that maybe achievable 25 million, and first put it in the governor's budget, and then get it passed in legislation for this next year. We have regional. Victoria's been really instrumental in pulling together member-led regional policy forums, which will kind of be our pep rallies. And then those are going to instigate FRCs inviting legislators to visit their facilities and really cultivating legislators this fall to really make the direct acts early next year. And we're hopeful it will be in the state budget next year. And I think I gotta go deal with dogs. Thanks.
Thanks, Michael. Thank you for sharing there. I do see a question from Leonore as well, and so we can definitely follow up with you on that question. I appreciate you adding it there. Thank you again to Michael, Amanda, and Victoria. A couple of resources I wanted to share with you all before we go. Looking onward, you are here today for a Webinar Wednesday network spotlight. We also have an upcoming overview of the standards with New Hampshire implementation. So New Hampshire member network will be sharing their story. And we also have a Family Resource Center engaging and supporting fathers to succeed webinar that will take place in September. The recording to this also will be on the website. So all of our past Webinar Wednesday series are available on the website as well. And we also have standard certification training. So Michael and the team reference standard certification trainings. This is available the 4th Thursday and Friday of each month. The NFSN offers open trainings for those. So the upcoming dates there, you can check out the website for more details, as well as getting connected if there is a trainer in your state that can provide the training. So members who provide this training get access to their information. We also have the Developing and Sustaining Effective Parent Advisory Committees training. This is a unique training that is focused on staff, really being able to build those parent advisory committees. It's co-trained with an NFSN staff member and a national parent leader. And there's more information on the website available, but we do have these offerings every 4th Tuesday and Wednesday of each month. So look forward to connecting with you on a future training opportunity. You can also contact us if you want to bring this to your area and have a state specific or focused on your organization. And we also have an upcoming conference that the National Family Support Network is a co-host for, the Together for Families Conference. It is virtual this year, October 19th through the 21st, and we encourage you to register early. It's going to be an exciting big tent event with all professionals from the family support and strengthening field, and it is co-hosted by the Center for the Study of Social Policy as well as Families Canada and our organization. We have lots of networking, virtual networking that will take place, as well as over 40 breakout sessions. We have 3 plenaries. We have a parent leader plenary focus that the parent leader planning committee is actually putting together and is so excited to share with you all. So check out the website to see what is available and to get registered today. The National Family Support Network also has resources available on the website. So I mentioned this earlier, but we have Family Resource Center overviews, there's sample RFPs, we have evaluation plans, information about data management systems. So the Colorado information can be found on there as well. We also have member network snapshots. Like I said before, go to the website, check out the members page, and by clicking on your state within that map, you can learn more, just like the Alabama example here on the screen, and as well as getting access to the standards of quality for family strengthening and support, which is a common standards available for anybody working with families to create a common language to support quality support. We also have a variety of services available. So we are happy to connect you to National Family Support Network member networks. We can also present, if you're interested in starting up in an FRC network, or looking at folks who are interested in funding family resource centers, we can do some specific presentations for those that may be involved. We also can provide technical assistance for FRC network development. So if you're looking at starting a network and how do you start, where do you go, we can provide support, and that is our wheelhouse. We also provide trainings on the standard certification trainings and the developing and sustaining effective parent advisory committees trainings that I had just shared with you before. And here is my contact information. If you want to reach out and follow up with any additional questions. And if not, we have an evaluation that will pop up on your screens. We thank you, and thank you to the California Family Resource Association, CFRA, for presenting for us today and sharing their story and their testimony of how they are impacting the families in California and supporting networks, individuals, and family resource centers. So please take a few moments to fill out the evaluation that will automatically pop up on your screens. It has specific questions about identifying your next steps and what we can do to support them, or what would support you. So I appreciate you guys so much, and have a wonderful Wednesday.